because I'm just having a good day, having a good day, having a real good morning. I'm just having a good day, having a good day, having a real good morning.
Hello everyone, we're back in the beautiful Capitol Park Museum for another episode of Ask the Experts with Mayor Broome and Healthy We Are. This episode, we're going to be talking about health equity, and it's also National Minority Health Month. We have a wonderful panel of experts to contribute to this conversation. And as always, we want to hear from you. So don't forget to drop your questions in the chat, like, follow, and share this video so it can reach more folks. Without further ado, Mayor Broome and Healthy We Are.
Well, hello everyone. We're in our episode 2 of Ask the Expert. On our first episode, we discussed nutrition, and this time, a favorite subject of mine as we talk about health, and that's health equity, and also National Minority Health Month with you, our local experts. And so, health is wealth. I've heard that said over and over, and health equity is essential for the welfare of our community. So all of our residents should have the same opportunities to lead their healthiest lives. I believe that we can all work together to transform the landscape of health in Baton Rouge. And so this week we will be joined by local health experts who can help us learn about health equity in Baton Rouge and what we can do to create a healthier community for all. So I'm going to call your name, and then afterwards I'm going to ask you to do a little brief introduction. We'll start with Dr. Antoine Keller. Dr. Keller, tell us a little bit about yourself. Who are you, what you do, and why do you do what you do?
Well, thank you very much for having me, Mayor Broome. And I'm a cardiothoracic surgeon, which means that I do open heart surgery on people every day, heart valve replacements and bypass operations. And it may be strange that a cardiothoracic surgeon would be involved in public health, but I think we have an obligation to protect our community and to inform our community, because cardiovascular health is a public relations issue. It's a public health issue. And so as a cardiothoracic surgeon, I think it's important to help educate people. Obviously, you have a huge interest in educating the public, especially on cardiovascular problems, because they're so prominent in our community. Lauren and Jared and the people who work with Healthy BR really do a very good job with that. So I'm a cardiac surgeon. It's a public health issue, and I'm very, very passionate about helping people in our community.
Thank you. Monica, Frederick, tell us about yourself.
Hi, thank you, Mayor. My name is Monica Frederick, and I chose nursing. I'm a registered nurse. I chose nursing as a second career and have been doing that for 26, going on 27 years now. The latter part of that has been in management, nursing management, for the past 14 years. So I'm in women's health, women and infants health, work in a hospital setting.
And last but not least, Dr. Allison Mitchell.
Thank you, Mayor Broome. I'm very excited to be here. I am a 4th year psychiatry resident with LSU in New Orleans, and I have the privilege to treat people who have mental illness. And mental illness is very important for our community because mental health is very important for our community, and it affects more than 20% of the population. I have the privilege of treating people in the outpatient and inpatient setting, whether they have psychiatrists or not. And I would like the public to know what signs and symptoms to look for, as well as psychiatrists are not people to be afraid of, but people that you can talk to and relate to every day.
Well, I'm so glad to have all of you all sharing with us in this session. So let's start with you, Dr. Keller. Are there any chronic diseases or conditions that disproportionately impact minorities? And if so, could you share some examples and details?
Certainly. Well, cardiovascular disease is the most common medical problem in America. And quite naturally, there are significant numbers of people in every community that have cardiovascular disease. And things like COVID-19 pandemic have really brought the importance of pre-existing conditions and cardiovascular disease to the forefront. Things like hypertension, which is 1.5 times as common in African American people as it is in non-African American people, but yet and still African American people have a much lower rate of treatment and of successful treatment of their hypertension. This is a double-edged problem. We have obesity epidemics, which are more common in African American people. Diabetes, twice as common in African Americans as opposed to majority citizens in our community. And peripheral arterial disease, all of these things have a much higher incidence in the African American community and in the non-white Hispanic community as well. And they're things that really do impact everyone's daily life in one way or another. It's really important to have initiatives like your Healthy BR initiative to provide educational resources to people so that they can understand how they can treat this as a wellness issue and not just as something that they have to go to the doctor for. Healthy lifestyles, as in your last segment, you talked to Chris Tyson about how there are food deserts or places where people can't get healthy foods to have healthy lifestyles. They don't have parks in their neighborhood where they can get exercise. All of these things are really important, and the only way that we can have an impact is if we have programs like yours that teach people how important these things are to their daily lives. Disparities exist, and everybody knows that disparities exist. What you're going to do about them is the really most important part. And one of the things that COVID has really taught us is that people have access issues. Right. And if they have access issues and then can have the same expectation of a favorable outcome if those access issues don't exist, then perhaps we should focus on helping them obtain access to these vital programs to help with their wellness, as opposed to only focusing on the end result, which is the hypertension or the chronic disease that they have.
You know, you mentioned the access issues, and obviously there are some people who, when we talk about disparities in access, they don't really understand, maybe from the larger community, the impact it has on serving the healthcare needs of individuals.
It's true. You know, we've learned from our friend George Bell at the Capital Area United Way that we have a very high level of poverty in the surrounding parishes of Baton Rouge. And so people may not have the resources to be able to take off an entire day to go to the doctor, or they may not have childcare for their kids that are now being homeschooled because of the pandemic, or they may not have insurance because they're gig workers and their employers don't pay for their insurance. So all of these things mandate that we have some cultural sensitivity with regard to having an opportunity to go to the doctor. And they're really important issues, and we have to team up to accomplish all of our goals with regard to access.
Dr. Mitchell, are you familiar with perhaps health programs and initiatives that are promoting health equity and some of their methodology to do so?
Yes, so there is the Louisiana Health Institute, and this particular institution, it has various initiatives for all forms of medical conditions and symptoms that people may have, whether it be cardiovascular, immune system conditions, or perhaps their mental health, where they have grants for that particular patient population so that they can have access to the medications that they need without having to come out of pocket. One really important aspect of equity versus equality is that you reach a person where they are, not necessarily giving every person the same thing. So some of the patients in our particular population may need vouchers, they may need different ways and modalities to have access, extended hours so that they can come into the physician. So this particular initiative, that LPH, they allow grants so those things can take place within the community.
Now, at a later date, I want to have a broader conversation around African Americans and mental health. But why has there been an obstruction to African Americans accessing mental health care. We talk about our heart, and rightfully so, and we talk about other chronic diseases, but the mental health in the African American community has either been overlooked or not talked about.
I believe it's because of the historical context of what being strong looks like in our community. And when you are strong in the African American community, you don't show your vulnerability. You don't show that you have deficit or that you are in need of something that people can't see, that's not tangible. And so there's a stigma associated with that for families, for faith communities, that if they are to reach out to help, that it means that they are weak. And so I believe breaking those barriers down involves a lot of education for minorities, and also to know that there is no weakness in getting help with conditions that still have physiological takings that cause them to feel depressed or anxious. It's not just an emotion, it actually is something that's going on in your body.
Now, Nurse Frederick, I'm gonna move to you. I have to start off with this question though first, because you said nursing is your second career.
Yeah.
You wanna tell me about that shift to nursing?
Yeah, my first career, I was a hairdresser, and I did that for 10 years, but in the middle of that 10 years, I knew there was something I needed to do that was more of a contribution to society and to help my fellow man. So I didn't know what that looked like at the time, but nursing came to the forefront for me as something that was achievable, but it was also would be the gratifying thing that I was looking for.
So what you've just done is encouraged other individuals who have that passion or desire to serve in a healthcare profession, but think, I can't do it, So thank you for sharing that. That's why I wanted to bring it out. But I want to ask you, what have been your observations as a healthcare professional, as a nurse, in terms of perhaps multicultural representation in your field?
Well, personally, I think it's very important, but statistically and with the literature that we have today, it proves it. So regardless of how I feel personally, that is what the literature shows us. It's true. When you compare everything, the only thing left is race, and you still have the vast numbers that we have today, then you can't deny it. So personally, what I've seen is the look on a patient's face when somebody walks in the room that looks like them and they exhale in relief. The lack of trust by a patient and their healthcare team, and then that trust is just exponentially grows when you see someone who speaks your language or looks like you. I think it's something, trust is probably, I keep saying trust, but it's the biggest thing that I see in my almost 27 years is what's lacking. So the barriers that produces is they don't communicate. Different cultures communicate differently. So even if I come from one culture, it's my duty to educate myself on the commonalities of other cultures, because I don't know, is this a norm for that culture? Is this, am I picking up on the idiosyncrasies that they're presenting as their provider and someone who's going to help their pain or help their psyche or help their outcomes? So I think it's important for them having a more culturally diverse healthcare team. We need to be able to speak to someone, a Hispanic patient, instead of waiting the time that it takes to get the interpreter, or to, wouldn't it be a dream if you had someone there all the time, at least for those languages that you experience the most in your organization. I hear it from the patients, just that I was so scared coming in here, and now that fear is gone and I feel like I can move forward with my care.
So, final question for you all to think about. I know you all are doing some admirable work in your sphere of influence within the healthcare system, and I greatly appreciate it. but just share a project that you're connected with that you'd like for folks to know about, or maybe something resourceful that you think would benefit our listeners. Dr. Keller?
Yes, ma'am. We have an initiative that's almost a year old called Heart Sense. And one of the problems that we have in cardiovascular disease is people don't know that they have cardiovascular disease. And for reasons that we alluded to earlier, they may never present to someone who can appropriately diagnose them with cardiovascular disease because of a number of access issues. So we have decided that if the people won't come to the doctor, then we are going to have to take the doctors to the people. And so we are doing murmur screenings for people wherever they are, churches, businesses, pharmacies, places where people congregate, community centers, because if people won't go to the doctor to learn that they have cardiovascular disease, there's new technology that we have access to where we can help direct them on a path to be able to get their heart disease taken care of. For instance, if someone has had a family member who's been told they have a heart murmur, we will go to the community, we will listen to their heart with a digital stethoscope that has artificial intelligence that can diagnose them with certain cardiovascular problems and get them into a system where they can be taken care of. One of the really good things that we do here in Louisiana is give people insurance. And we have a very low rate of uninsurance. It's about 8%, which is remarkable, I think. So it's not because people don't have insurance that they don't go to the doctor so that they can get taken care of. We feel that it is an access issue. So Heart Sense is going to be helping to remedy that problem. So if anyone has a question about their cardiovascular fitness and you see our Heart Sense flyers around, come and visit us because it could save your life.
Excellent. Nurse Frederick, project you might be involved with or something that you believe would be resourceful to our listeners?
I think as we try to educate ourselves and grow our knowledge base, make sure that we're using evidence-based practice. So we belong to other collaboratives and try to knowledge share with other organizations to try to improve our care. So I guess other than a resource would be just to challenge people to educate yourselves and to be vulnerable and reach out when you think that you don't have options. There are options out there. Just, ask a friend, ask a family member, reach out, talk to your doctors. There are resources, and when you think you're, feel unsupported, there are people out there who care.
And that's good to know that there are people out there who care. Dr. Mitchell?
Yes, so I believe, and many of us have already spoken about, that representation really does matter. And so through LSU School of Medicine in New Orleans, there are several initiatives through the Diversity Office that they go into schools with medical students to help mentor the students there as young as 2nd and 3rd graders and as old as high schoolers, so they get a chance to come on the medical school campus and see what we do. And I believe that can truly help educate the community as well as empower our youth to know that they can reach for the stars and that they can be anything they want to be, including physicians.
Well, this has been certainly an insightful conversation. I want to thank all of you all for participating, and thank you for all the work that you do in your sphere of influence. I greatly appreciate it. And make sure to join us next time on Ask the Expert.
Thanks for having us.
I want to thank Mayor Sharon Weston Broome for coming to the Capitol Park Museum and that we could partner to help promote her Healthy Baton Rouge initiative. It's so important to all of us that we appreciate our history and culture and that we become a richer community for it. So we hope that you can visit Capitol Park Museum. Thank you.